everyone. I wanted to thank everyone who has come on tonight. We have a informative information session about the COVID-19 distribution, as well as other information that our commissioner and our senator will give you from the state level. And Beth Duffy is from Einstein Medical Center. She's the CEO, and they have a wealth of information that they will share. And I would like to introduce you to our moderator, Ms. Jamie Mogul. She will be moderating and asking and sharing information that will be needed. And with that, I introduce to you Jamie Mogul.
Thank you, Ms. Linda. Linda Fields, thank you also for setting this up to inform the public. We're all looking for answers, and you put together an amazing panel. So I'm going to get right to it because we only have an hour. But first, just logistics for those of you who are watching but think somebody else hasn't been able to sign on tonight. It is being live streamed if you want to share it on the Power Up PAC. Power Up PAC PAC Facebook page, and it is being recorded, which we will share out if you want to send it out later. And then also it's really important to let people know what you learned tonight. So really, please, we ask that you be engaged, but first that you listen to our wonderful panelists, as maybe your question will be answered, but we will open it up for the chat later on, but I'm going to get right to it because there's a lot. As I said, we only have an hour. You heard our great panel, so we get to hear different viewpoints. So we will hear from Dr. Valerie Arkush, our chair of the Montgomery County Board of Commissioners. And then we have Senator Art Haywood, who represents parts of Philadelphia and Montgomery County, and also happens to be part of the Pennsylvania Task Force on COVID-19. And then we're lucky enough to have a different perspective that from the medical community, although Dr. Arkush would do that as well, but from the hospital's viewpoint and administration, and that's Beth Duffy, the CEO for Einstein Medical. So thank you all. We're gonna start pretty broad, and I'm gonna ask you, what is your perspective? What do people need to know, whether it's from the county, the state, from the perspective of the hospitals? What do people need to know? I'll give you maybe 5-10 minutes because then we'll get into more specific questions. So I'll start first with Commissioner Arkush.
Thank you, Jamie. Good evening, everyone. Linda, thank you so much, and Michael for helping to organize all of this. And it's always a pleasure to spend some time with my state senator, Senator Art Haywood, as well as my very close colleague, Beth Duffy, who works at Einstein Montgomery and has been just a critical partner in this work to find COVID. So a couple quick comments as we get started tonight. First of all, I want everyone to know that our coronavirus numbers are moving in the right direction. And that's thanks to everybody's hard work, wearing masks, watching social distancing, keeping your hands clean, all of those things that you are incredibly sick and tired of doing. But we need to keep at it a little bit longer. We're not quite out of the woods yet, but the end is in sight. And part of why that end is in sight is because we have vaccine here. We don't have enough vaccine yet for everybody who wants to be vaccinated. And the rollout has been really quite difficult, and we can get into some of that later. And it's mostly been difficult because we have way more people, and this is a good problem. We have way more people who want the vaccine than we have vaccine to give them. So although I know it's been frustrating and people are so anxious to become vaccinated, just hang in there. It is coming. The Biden administration is already increasing the doses that are being distributed to the states. We just over the weekend had a third vaccine that was approved by the Food and Drug Administration. So we have another tool in our toolbox now, and we are going to get there. So my big picture message tonight is hang in there. Keep doing the hard work of wearing a mask and staying socially distant, keeping your hands clean, but the end is in sight.
Okay, I'm going to turn it over next to Senator Haywood. Maybe you can tell us from the state perspective. Of course, we're hearing a lot that we're not getting the vaccine, but maybe you can give us the perspective of the work you're doing and maybe make us feel a little bit better.
So thank you so much. Thank you all for inviting me, and I'm glad to be on the panel with these outstanding folks. I was recently asked to be on the governor's vaccine task force, which the governor chairs, and there are 2 members of the state house and 2 members of the state senate. Prior to that, though, and I've been the Democratic chair of Health and Human Services, and very involved in trying to make sure people got tested, and then at this stage getting vaccinated. I do really want to highlight, though, what Dr. Arcus says of the importance of wearing masks and social distancing, because we still have a virus that's spreading in the community. And the vaccine rollout is much slower than the virus rollout. The virus is spreading every minute. And so I strongly encourage people to wear masks and do the social distancing now. In terms of vaccine rollout, it's been a rocky rollout, is the best way I could describe it. That has a number of reasons why that has occurred, but instead of talking about the past, let me talk about the present. Johnson & Johnson just got approved. That vaccine is effective against death and hospitalization, and that is a 3rd vaccine. We're expecting to get about 95,000 doses in Pennsylvania this week. And later in the month, we may get significantly more doses. Having 3 vaccines will significantly increase how much vaccine can be provided into communities. The state is managing a combination of vaccine from the federal government that's being directly allocated to some pharmacies, directly allocated to some federally qualified health centers, directly allocated to some HUD, elderly, low-income housing. So on one hand, there's a federal allocation that is directly to certain providers. And fortunately, one of those was in connection with nursing homes. The federal government provided pharmacies directly nursing home doses, and the nursing homes doses have been completed. However, that's only part of the picture. The federal government also is allocated to the state. And the state has about 700 providers that have been used to date. We have looked more closely at those providers and determined that some of those providers are very efficient in getting doses out, and some are not. And so we're currently looking at scaling down the providers that receive doses to those that have a greater capacity to get them administered. So we're very much in a process of getting the doses out. I would say that from an expectation perspective, that folks should expect who are 65 or older or in the 1A high priority, that there's a good chance that they will be vaccinated by the end of April or sometime in May, assuming we get the increased doses from the Biden administration, which has done a tremendous job so far. That means, however, for the general public, those who are under 65, laws like me, that means that it's going to be probably June, July, before the vaccine really starts to get into the general public. So I do think the creating an expectation that's consistent with the actual supply is very important. I know that Joe Biden will get on TV and say, I got 200 million doses, or some other official will say, I got 100 million, I got 200 million. I think the 100 million projection is for the end of March. The 200 million is for May. So don't get too distracted by these big announcements. It's going to take several months before it gets done. But as Dr. Arcus says, we will get it done. Thank you for allowing me to share that.
Well, that's good news. Thanks so much and now we're going to hear a different perspective, and I think as much an important one. Beth Duffy, I'm going to let you take it away, what you're seeing as far as COVID, and I'm hoping, and as Dr. Akush said, the numbers of hospitalizations have gone down, but also what you're seeing from your perspective of administering the vaccine.
Thank you, Jamie, and thank you to Linda and Michael for allowing me to be part of this really important discussion, a very timely discussion. And I also want to say how honored I am to be on a panel with Senator Haywood and Commissioner Arkush. So, we've been at this now for almost a year. Sometimes it feels like it was just a few weeks, and sometimes it feels like it was, many, many years. We've learned a tremendous amount, and the good news is that the numbers, as Commissioner Arkush said, are coming down. At the peak, Einstein Montgomery had high 50s of COVID patients in the hospital. We've treated and cared for over 4,000 patients in the course of the last year. Today, our inpatient census was in the 20s. So the numbers are definitely coming down, and not to beat a dead horse, but the importance of making sure people social distance, wear their masks, and wash their hands cannot be stressed enough, because that is the only way, until everyone is vaccinated, that we will be able to adequately fight this virus. From the perspective of a provider, I can tell you that December was probably one of the most joyous months I have ever had the privilege of being a healthcare administrator for, because we were able to start administering the vaccine to our employees. We have over 2,100 employees at Einstein Montgomery, and the very first arm we were able to put a vaccine dose in was one of our emergency medicine physicians, who has been in this on the front line, working really, really hard to care for patients. And it just was such a relief, and it was just such a happy thing to be able to give to people, because it really does mean that there is a light at the end of this tunnel. Unfortunately, there's not enough vaccine to go around, and I know we'll talk a little bit about that more in a few minutes. But I do want to reassure the audience that Senator Haywood and Commissioner Arkush are working extremely hard to make sure that Pennsylvania, and in particular Montgomery County, gets the allocation of vaccine that is available and can get into the arms of the residents of Montgomery County. Commissioner Arkush has just done a fabulous job in preparing the county, and they are well poised to vaccinate many, many more than myself, Einstein Montgomery, or any other hospital or pharmacy provider could do in a single day. We just need to get the vaccine. And I'm hopeful from what Senator Haywood has said today that we'll start to see that allocation increase, and more of us will be able to get vaccinated. Thanks, Jamie.
All right. Well, thank you so much. And I think we all need to savor when we hear good news, because it's been hard. So thank you all for what you're doing, what you continue to do. And we're going to cherish those good stats and those good stats because they matter. So just getting into more specifics, we talked about how many vaccines, that maybe we'll be getting more, and that's all wonderful. But I'm going to get right to it, because we've seen in the news, particularly information that people from Montgomery County or outside Philadelphia made up 40% of those getting vaccines in Philadelphia. Or we've been hearing, no, you should go to a private facility like a pharmacy as opposed to the public, maybe through your healthcare provider or through the county. So I'm going to ask all of you, what are the ins and outs, and what's specifically happening, and where should people go? Because we hear all that great information from you, but in the realistic terms of things, people are very confused. They're confused whether they go on the Montgomery County website, or do they go, and we've heard about people driving to, hours away, to other people who just were lucky enough to get a slot. So I don't know who wants to take that, because I know it's a big question, but I think we do need to address of like the public versus private administration, and more importantly, what you all recommend for us to tell somebody or somebody who's watching or our family and friends. And I am going to talk more specifics about seniors and people who maybe don't have access to internet. But overall, I want to hear what you think and what you want to tell the public as far as where they should go and sign up and get their vaccine. So I don't know who wants to take it first.
I'll start.
Okay.
I'll start, because this issue's been so terribly confusing for people. So first of all, it's very important to understand that Philadelphia is different than the other 66 counties in the Commonwealth. Philadelphia historically has always gotten their vaccine directly from the federal government, and that includes, flu vaccines, all kinds of vaccines. The other 66 counties in the state get our vaccine from the Pennsylvania Department of Health. As a consequence, 66 counties are operating under one set of directives from the Pennsylvania Department of Health. Philadelphia County is operating under a different set of directives that their health department is overseeing. So that issue alone has created quite a bit of confusion. Right now, today, we are, if you're 65 and up, you're eligible for vaccine in 66 counties in Pennsylvania, but not in Philly. And if you live anywhere but Philly right now, you're not eligible to get vaccinated in Philly unless you work there. So if you live or work in Philly, you can get vaccinated there. But but in the other 66 counties, we are not allowed to turn anyone away depending upon where they live. So right there, you can see how this has gotten so confusing so quickly. We are under two different sets of directives. So here in Montgomery County, I have a couple of suggestions. First and foremost, and if you're not already signed up with the county, you should do that. And when I'm done talking, I can type the URL into the chat, but it's very easy to sign up. You go to www.montcopa.org/COVID-19. And at the top of that page, you'll see a button that says vaccine information. Click on that and click on county information, and that will take you to our vaccine page. And you can sign up there as an individual, or if you're a healthcare worker that hasn't been vaccinated yet, there's a special place for you. And as long as you're in the 1A group, which means you're 65 years of age or older, or under 65 with one of about a dozen healthcare conditions, you're welcome to pre-register with the county. That will get you in the county's line. Right now, there are over 170,000 people in that line. But as it turns out, some of those people have already been vaccinated, and we're starting to move through that line as quickly as we can. Now, signing up there only gets you in line for the county. There is no centralized system right now in the state. So then the next step would be to keep an eye on different pharmacies. And on that same webpage that I directed you to at the beginning, there is a map that comes from the Pennsylvania Department of Health, and you can click on that map, and that shows every provider in the state and whether or not they've received vaccine. Most of the pharmacies that have vaccine right now are Rite Aid pharmacies, and that is because the federal government is also sending vaccine directly to some Rite Aid pharmacies in Pennsylvania. And so Rite Aid has their own website where you can sign up to get vaccine. And occasionally, from time to time, there are also pharmacies in Montgomery County that get vaccine from the Pennsylvania Department of Health. So unfortunately, there's not a short answer to Jamie's question. Well, there is a short answer. You should sign up everywhere that you have time to sign up for. There's no harm in signing up at more than one place. There's so many people that need vaccine right now that in our case, if we send out 1,000 appointments and only 800 of them get filled up because those other 200 people got vaccinated, we just invite 200 people to that clinic. So you should just sign up wherever you're able, as long as you have the time to sort of invest in this, sign up. Additionally, for individuals that don't have good internet access or don't have an email address, we have a phone number you can call. And that phone number, and I'll type this into, is 875-3967. And if you call that number between 8 and 4, just tell the people that answer that you need help signing up to make an appointment, and they'll transfer you over to a set of individuals who that is all they're doing. They're registering people by phone. We have 160 amazing people who have volunteered in Montgomery County. They've all been background checked and trained, and they are doing this phone registration for us and working with our senior services department. So they will register you by phone, and then when your turn comes, you will get a phone call back, and they will help you make your appointment, again, over the phone. So it is not necessary that you have internet or an email address or a computer or anything like that.
Wow.
Val-
Yeah, that's all right. And I was going to ask Beth specifically, which I think I hear you have something else to add, so please do. But I want to also ask, what if you had a patient who was like through the Einstein or mainline health? You know, I know with my mom, she's like, oh, I have to go through my provider. Of course, I've told her to sign up everywhere, as Dr. Arkush said. But maybe you can tell us what you're telling your patients, and then, of course, what you wanted to add.
Sure. Well, we're telling our patients exactly what Commissioner Arkush just said. We Einstein Montgomery are not offering the vaccine in our practices. The complexity, again, of this whole system is that each of our practices is registered as a vaccine provider. We were registered before COVID, and as such, each practice would have to order their own vaccine, and they would get very limited quantities. And in regular meetings that we have with Commissioner Arkush, we have decided, at least from the Einstein perspective, that it would be much better if Einstein's allocation could potentially go to the county so that the county could then vaccinate as many people. They have an infrastructure in place. They just need the vaccine. So if we can help get the vaccine to Montgomery County, then a lot more people would be able to be vaccinated, more so than what Einstein could do. And what I started to say was the Montgomery County website works. So today I got notified that my 96-year-old mother was up for her vaccination in Montgomery County. Yay, Mom. I'm so happy. And, you know, I registered her like everybody else registers, pretty quick to do online. And as you heard, there's adequate phone service or answering service to take people who don't have the technology.
It's amazing to hear how you're coordinating, and I think our county and our leadership exemplifies doing that. But maybe we can ask Senator Haywood, are the counties getting the resources and the funding that is so very necessary to do this coordination and make sure that they're supporting not only fighting COVID, but the administration of the vaccine?
Let me say two things. First, to answer that question, they're not getting it from the state, and the state's not getting it from the national government. So I think support for counties, the real support that counties need to have strong vaccination programs, is not really coming much from the state. Now, the $1 trillion or $1.9 trillion that is being proposed from the national government has a significant amount of money that would then allow states and counties to have strong, robust vaccine programs. But the state government doesn't have those resources at this time, really, to have robust county systems. There's some, but it's been very limited. I do want to say also, though, on the question of who to contact, the state has a Your Turn device as well, but I strongly encourage people to go in Montgomery County, to go to the Montgomery County site that Dr. Arkush has used, that uses and has described. As she says, it uses some of the state resources already. So I do not really encourage people to do duplication, which would be to go to the state site and the county site. I strongly encourage people to go to the county site for those resources. But the resources, even for the state to administer the state program, are severely lacking, and we've gotten very little support from the last national government administration. Hoping the Biden administration will do much, much more for us.
I want to talk about some more specifics. We got a lot of questions about seniors and also communicating. I think they kind of go together about communicating the phone number, or even people, look, we live in, and it's quite jarring how many people do not have access to internet. So it's not just seniors per se, maybe, who need help. And Beth, I'm so glad that your mom is signed up and going to get a vaccine. But I do know we got a lot of questions about seniors particularly, but also poor, low income, but also people who just don't have access to internet, which we've seen play out with the issue of having to do virtual schooling. So maybe one or all of you could speak about what is being done to make sure that's communicated. I know Dr. Akush can speak to the county, but we've also been asked, are you going to do mobile vaccine distribution?
So I'll start with this one. So from to go to the question of how are we letting seniors know who aren't on this Zoom, right? That's really the question. We're doing a bunch of things. So first of all, we have our Office of Senior Services, which is a county office, has partners all around the county that actually provide services to seniors, senior daycare locations, lots of places like that, Meals on Wheels, all of that. So the numbers being pushed out through all of those organizations. Additionally, we're working very closely with AARP. They have a very large number of members in Montgomery County, and I'm doing a tele-town hall with them next week. Not an internet town hall, but a tele-town hall. That's the thing where they call the people. I know Senator Haywood does this all the time, very, very successfully. And they told me today, we had a prep meeting, that they often get 25 to 30,000 people on that call, just like in our county. So we're hoping that that will help quite a bit. They're also putting it in their mailed communications. We've shared this info with our entire state legislative delegation and federal delegation, and we're asking them to include it in their mailed communications to their constituents. And then it's been in the newspapers. We're asking all the townships to help publicize it. Many of them mail out newsletters. So we're working really hard to get that phone number out there. Now, in addition to that, we are starting to do mobile clinics. So we are working with some of our hospitals as well as the county itself. And we are prioritizing facilities that are affordable housing for elderly specifically. So that's where we're going to start. We have about 30, at least, maybe a little more than 30 HUD affiliated, in some way subsidized elderly housing, congregate housing. And so we are starting there. The county is doing 2 sites this week. One of our hospitals is doing, I think, 2 or 3 sites this week. And so we're going to spend about the next month trying to get to each and every one of these locations, assuming that they would like us to come. And we will be bringing vaccine to those places. And then there's another group, even trickier, which are the homebound, seniors that are truly homebound. And we're working on outreach. There is one pretty large medical practice in the county that serves the homebound specifically. And so I'm getting ready to reach out to them. Somebody from them could be on this Zoom. I haven't actually reached out to them yet, but to see if we can find a way to work with them to come with them, for instance, with vaccine to deliver it to people. It's very tricky with the 2 vaccines that we have. The way that it has to be handled is quite specific and with very little opportunity for any kind of error. So we really have to stay with the vaccine. It's not the kind of situation where we can just give it to somebody and have them go give it to another person. It requires very specific temperature control and things like that. But I'm hopeful that once we have the Johnson & Johnson vaccine in greater supply, 2 things with that. One, it's much less fragile. And so the ability to transport it around is easier. We don't have to worry as much about the exact temperature of it. And then it's only a single dose. And so that could be really, really helpful in efficiently getting to homebound individuals experiencing homelessness, other very, very vulnerable populations. So we've got plans in the works for all of that.
I see Linda wants to, so I'll let her take it away. So she has her hand up to ask a question.
I guess I'm a fan of Einstein because they do have home care nurses, and I think, and it's a large group of very, very qualified nurses, Val, that I think would be one of our first steps. That was something that I was going to ask about and suggest. So that's it.
All right, well, I'm going to ask more specifically, and this is all information we also will be, when we share out the video or all of the great phone numbers, the website and all of that. More specifically, I want to get to some of the categories, the 1A that everybody's been hearing about, and maybe Senator Haywood, as I believe this is set, what is specifically going on? I hear specifically, we got questions about teachers. Philadelphia, I'm hearing, is an anomaly, so I'm not going to talk about that specifically. But what about adding teachers, as it's very important that they get vaccinated? So maybe you can speak to that, Senator Haywood.
Yeah, certainly. So the vaccine task force specifically discussed vaccinating teachers and putting them in the 1A category so that they could be vaccinated. We recommended that teachers move up in priority so that they can be vaccinated. So I'm anticipating there's going to be an announcement from Governor Wolf on Wednesday of this week about plans to vaccinate teachers, and I'm confident they will be in a new priority. I do want to share, however, that the reopening of schools and teachers being safe has been determined by the Centers for Disease Control for some time. That it's safe for teachers to be in a classroom if they're not vaccinated. And across Pennsylvania, there are a number of school districts which are either in 2 or 3 days a week where the teachers are not vaccinated. So this is an extra step for the security of teachers and staff at schools for them to be vaccinated. Governor Wolf will make an announcement on Wednesday, which will put teachers and their staff in a position to be vaccinated this month, I believe, in March of 2021. I just wanted to share one thing with respect to spreading information on the 800 number. Elected officials across Montgomery County are having telephone town halls and Zooms and sending out e-news with this information that Dr. Arcus has shared. And so I will say there's a significant effort to attempt to get the information out through the means that we have. It doesn't mean that more can't be done. I'm certain that more can be done, but there's a significant effort to get the information out.
And I just want to bring up, many viewers may not realize the decisions being made about reopening schools. Maybe you can explain that, because I don't think people understand who does that.
Certainly. There are 501 school districts in Pennsylvania, 501. And each of those school districts get to make a decision about opening or not opening, or having 2 days a week, or going all virtual. So there are a lot of school boards that make those decisions. The governor does not appear to have the authority to order school boards to open. Nevertheless, I do believe that the vaccine will be a big incentive for school districts to open.
That's good to know. So going back to vaccine distribution, I want to ask a question to Beth Duffy from her perspective, especially. We've been hearing a lot about vaccine guilt, that maybe you are qualified, whatever it may be, being under a certain age, but you hear about other people who haven't been able to access, or people who haven't been able to access. Maybe you can speak to that and what we can encourage people to maybe communicate to others, so there isn't that feeling of or maybe you're going to say they should feel guilt. I don't think you are, but maybe what we can tell to others who may be talking about this.
Yeah, sure. So this is hard because it's kind of basic economics. There is a huge demand, and the supply can't meet that demand. And so the people who have been able to get vaccinated are, lucky, and the people who aren't are frustrated. And so sometimes I think that leads to some bad feelings. But nonetheless, we are all supposed to be following the guidelines that were set forth by the state, which was we started with our healthcare workers. And now, just speaking for Einstein, we're almost through that, although we'll continue to have people who didn't want to get it before or weren't able to get it before for whatever the reasons, then decide they want to be eligible. We have new employees, so we will continue to vaccinate our own employees for the foreseeable future. We also have vaccinated members of our medical staff and their staffs who see patients. So we've gone out and done that outside of our own employees. And then again, working with Commissioner Arkush in a kind of coordinated and collaborative fashion, because we sometimes had vaccine and the county didn't. There were frontline county workers who met those criteria that we were asked to assist in vaccinating. So we did some of our first responders in Montgomery County, and I think all of the hospitals in Montgomery County participated in that. That being said, again, my philosophy, and again, this comes as a collaborative approach, is that the best way to get the most people vaccinated is to give the county the vaccine that they need. And if that means that I don't order 1,000 doses this week so that 800 of them sit on the shelf and I vaccinate my 200 employees that are eligible and waiting, then I want to make sure that 800 doses gets to the county so that more people in Montgomery County can get vaccinated. And so I think the word to use is patience, although I know that it's really, really hard because it's something that everybody wants, and right now everybody can't have it.
Yeah. Well, getting to something you said, we got some questions about what about the vaccine that can't be used, right? Is there a policy? Maybe each of you could speak to it. I don't know this, and I think people are very curious. I've even heard stories like, oh, you should call and see if any is left over at night and hurry up and get over there. So maybe you all can speak to that. Like, what is the policy, and is that true? And maybe there are policies or not. It depends on where you go.
So I'll speak.
Yeah, go ahead, Beth.
I was going to say, I'll speak for Einstein and what we've been doing. So our philosophy has been, we do not ever want to waste a dose because we can always find somebody. We've had a list of employees, as I said, who are constantly new employees coming on, employees who are changing their minds. And so we've been able to kind of have to run around and coordinate it and watch your schedule really, really closely. But we've been able to maybe, I would say, have 2 doses that we had to waste on one day when we couldn't find anybody. And when we couldn't find anybody, a woman was coming into the cafeteria where we were vaccinating. She was getting a diagnostic test, and she came to the cafeteria to bring soup home for her family. Her name's Miss Evelyn. And I had 1 dose left. And I went up to her, I said, introduced myself. I said, are you interested in getting vaccinated? Well, you would have thought that I changed her world for that day. And so she's the only county person outside of Einstein that I'm aware of that we vaccinated. But, it was another needle in somebody's arm, and every needle we get in there helps to fight the fight. So.
And Commissioner, I think you were going to say something.
Yeah, so at the county, what we do is at the beginning of every day, we identify the next 15 or 20 people on the list, and they get a phone call and they're asked whether or not they would be able to come to the vaccine site in relatively short order in the afternoon if we call them. And so then what happens is, as the day goes on, we tend to run about 6 lanes of people being vaccinated. So as the day goes on, as it gets later, they stop opening a vial for each lane. And then they make sure that the vaccine is pulled from open vials so that by the end of the day, sometimes we have almost nothing left, but we usually have a couple of doses. And so with about half an hour to go, then they start calling those people. So it's worked out great. We have virtually wasted nothing, and we just keep working down our list of people. Now, again, this has been another place where I think there's been some different approaches in an effort to not waste any doses. And so, you know, I've heard from a number of constituents who said, oh, well, my neighbor who's 30 happened to be at some particular drugstore. And I'm sure those stories are true and those people just got lucky. But that is only being done in an effort to not waste any doses.
All right, that's good. That's good to know. And is this coming from the state level to the counties? I would say the 66 counties, as far as recommendations, Senator Haywood? Oh, you're on mute. Well, let me unmute you. I don't know, Michael, can you unmute?
I'm asking him.
Oh, there we go.
I got you.
Okay.
Don't waste any doses is coming from everybody, the state, the federal government. So the don't waste any doses is a common message. Now, unfortunately, we haven't been able to produce a predictable supply of vaccine to providers. And so that has created a lot of challenges for providers to know in advance how much vaccine they're going to get. And then, in fact, that's been in part from the national government. The state has found out how much vaccine it was going to get sometimes a day before delivery. So that's been obviously very challenging. However, the Biden administration is now telling the state that we will know 3 weeks of doses in advance. Now, I got to tell you, that didn't happen, because even though they told us this was going to happen, yesterday they told us we're getting 95,000 doses of Johnson & Johnson. And so there's a lot of significant unpredictability that the state is under. And of course, then we pass that on to the counties. But hopefully we'll get to a point where we know how much we're getting and can share it. I'll say one other thing about the providers. There are about 700 providers that have received vaccine in Pennsylvania. We are going to narrow that down to probably about 300, the 300 that are really successful in producing. So some of the pharmacies who have received vaccine in the past will not receive vaccine for some time. So that will be a point of disappointment for some providers because they will not be receiving vaccine. But we've got to strengthen this provider network so it can be productive, and getting it down to a manageable and productive size is what we are currently in the process of doing.
That's great. I know Linda wants to say something. I know we're getting close to time, and then I'm going to ask you all one question, and thank you. I see Commissioner is answering all these questions already, but we do have some in the Q&A, which I encourage people to put the questions in there. And then I'm going to ask you about just generally about people who may not want to get the vaccine and what we say to them, but I'll let Linda take it away first.
Okay, yeah, I wanted to, I heard, that stood out for me, Senator, where you said a lot of people that from 700 to 300. Providers, that's alarming. And the pharmacies, we have pharmacies in the Black community that have been giving vaccinations, and I would hope that they would not be the pharmacies that would not receive that, because there's a disparity in the number between who gets the vaccinations, and the minorities seem to be suffering the most. So there are a list of pharmacies that have been given the vaccination. They're having a hard time getting their second round of a vaccine. And I'm hoping and praying that we will advocate for those pharmacies to continue to get that vaccine.
Let me respond to both points. First, on second doses, pharmacists and providers will be provided with the second doses so that individuals who got the first dose will get the second dose. It may be, we've understood that the second doses can be between 21 days and 44 days if there's some time that's permitted for the second dose, but we are guaranteeing second doses to all folks who got a first doses and the providers. So I do want to address the second dose concern. Second, we have a significant problem with racial and ethnic disparity in the vaccination. We're about 15% of our total population has been vaccinated, and the African American share, I think, is 1 or 2%. The Latino share is about the same. So at the task force level, we are looking at some policies that will make sure we improve the vaccinations of racial and ethnic minorities as well as the disabled. And hopefully we'll have an announcement on how we do that sometime either this week or next week. But it's a clear, significant challenge that we are looking at how we can address.
And can I add a really important point about that?
I was going to ask Commissioner Arkush, we did get specific questions about that in Montgomery County. So if you want to add that on.
So here's the thing. We've been working very closely with the Department of Health. I'm trying to see if I have it right in front of me here, but I don't, to get this data. And we got our first set of data from the Department of Health about a week ago. So we analyzed it. And what we're seeing here in Montgomery County, and to put this in context, according to the census of the population of Montgomery County, it's about 9.6 or 7 or 8% individuals who identify as Black or African American. So let's just call that Black, about 10% Black. With the vaccine data that we have, we are vaccinating, of all the people that have been vaccinated, 4.2% identified as Black or African American. So if we were doing it proportionally, it should be 10% of the people that we vaccinated should identify as Black. We're seeing 4.2, but here's where I need everybody's help. We have in that data about almost a third. It's about, it's a solid 25%. It's a little more than 25% of the people who've been vaccinated declined to identify their race, and an even higher percentage declined to identify their ethnicity. So when it comes to the Latinx community, as well as the Black community, as well as the Korean community, you can pick your community, we're seeing a lower percentage being vaccinated in all of those communities. But we've got an enormous number of people who have not shared that data with us. So I do realize this is sensitive. I do realize that many people are quite uncomfortable sharing that data. And I'd be interested to hear what Senator Haywood feels about this. But from my perspective, it is so critically important that people take that deep breath and share that data with us, because we will not be able to understand how we're doing without accurate data. And when a third of the data is a question mark, I can't really tell you with any certainty how we're doing. So it's critically important.
And I know Senator Haywood's going to follow up on that, but I, from the county perspective, and we did get questions about this, are there partnerships, say, with the clergy, particularly the AME Church, or community groups? Is there something, and even if you haven't connected, that people in the community who may be listening or know somebody, what can we tell them to make sure they get in touch with you, or do they just call that hotline?
Well, let me just
ahead, Linda.
There is the Black clergy, there is the NAACPs, and again, this is a collective. What we're doing tonight is not just Power Up and Jamie Mogul and Mike. It is a collective of organizations, the YW, the NAACP, I actually invited a Clamo, but I found out that you had already done something with a Clamo, Val. So this is all engagement for everyone. I just want to get the information out, but of course I am personally have an affinity for making sure that the Black and Brown community is getting the equal service that is needed. And that's important to me. And the way to do that would be through the clergy, the ministerial. It doesn't necessarily have to be just the Black churches, because there's a multitude and mixture of Black people in the various denominations.
You know, Senator Haywood,
Yeah, certainly. So let me address the reporting first. And what Dr. Aku said is exactly right. I looked at the same reporting that she did, although more for the state. And we have to obviously encourage people to complete it. And we've got to encourage providers to seek it. Because in some parts of the state, the challenge may have been that the provider may not have been as clear about the importance of getting the information. That's not going to be the case for most of us in Montgomery County, but I'm just thinking about statewide. So we are actually going to encourage, we're doing some more training of providers and encouraging providers to actually get this information that's ethnicity and race. And in terms of the community clinics, Dr. Akus has already identified that they're doing community clinics at low-income housing, and that they will continue to do mobile and community clinics. I believe that these community clinics are a critical way to get folks vaccinated, and doing them in combination with religious organizations or fraternal organizations is important. Doing them in certain community centers and neighborhood centers is also important. But I think that in terms of expectation, the county does not have enough vaccine to do a lot of community clinics. The county does not have enough vaccine to do a lot of anything. So I do think it's important that we keep these items on the agenda, get them scheduled so that there's an expectation that there'll be a clinic at in Crestmont and a date and time for that clinic. Obviously, we need a clinic in Crestmont. But the expectation that this stuff can be delivered quickly is not really fitting with the supply of the vaccine. So we just got to be careful in terms of supply and expectation.
And just getting back, I can't believe it's already 7:52, and I'm sure you all talk about this all day. But I want to talk also about, which is, look, I even have friends and family who say to me, well, I'm going to wait. Or you also hear a lot about, oh, well, I think, I could get really sick and I'm not going to get the vaccine, or just straight up people saying, I'm not going to do it. So maybe, Beth, I'm sure this is something messaging at the hospital, Commissioner Arkush and Senator, but I thought I'd start with Beth to really, what can we do to encourage people and counter this kind of, this kind of messaging?
Yeah, so clearly, Jamie, there's a lot of misinformation out there, and I know, a lot of people will talk to their friends or, Google it, or just get not right information, unfortunately. And so, we've taken a stance of just doing a one-on-one. When we run into an employee, we'll ask if they've gotten vaccinated. If they say no, we'll ask why. We're not mandating the vaccine, but we are trying to get the correct information out to people to make sure that everybody knows it is safe. Probably the second, people have concerns about its safety because they've heard incorrect information. Then the second thing is just fear of being vaccinated. It's been amazing to me to hear how many people really don't like to get a shot in their arm. And I've held so many hands of people. So, we allow employees to bring a buddy with them if they wanted to, if they were fearful of getting vaccinated, and just overcoming that fear. And then I think the third thing is that I'll say the inconvenience, because right now all we can offer is a 2-dose vaccine. And so, scheduling that second appointment, making sure you remember, something comes up, you can't come in, can you get it, rescheduled? It's a logistical nightmare. So clearly the Johnson & Johnson vaccine, as it is only a 1-dose vaccine, will eliminate some of the logistical kinds of barriers that have occurred.
And maybe more specifically also, this fear of side effects. We've heard a lot of stories. I'm sure, Commissioner, you've had to deal with this. What is it that you can tell everybody and that we should be telling our friends, our neighbors in the community to really counter this messaging, and that it's okay if you have some flu-like symptoms?
Yeah. So first of all, I always encourage people who have concerns about the vaccine to be sure to talk to their healthcare provider. If they have a healthcare provider that they trust, that provider knows them better than any of us do. So they should discuss their concerns with their provider. So that's always the first place to start. Second, these vaccines, all 3 of them, have been very widely tested in populations on the order of 40,000 people with each of those different vaccines. They've been tested in all different types of communities, and the vaccines have been just as safe and just as effective in communities of color as they have other communities. So that's very reassuring. So the other piece of this is that when vaccines, none of these 3 vaccines can give you COVID. I don't want to be just 100% clear about that. It is impossible to get COVID from these vaccines. They are not injecting the virus. They are injecting instruction sheets for your body to make antibodies. That's effectively what's being injected. So you cannot get COVID. Now, if your body's following that instruction sheet, it's going to start to make antibodies. And so it has a little bit of reaction to the instruction sheet, which is a good thing. And what we're seeing is very mild responses, oftentimes no response at all or no reaction after that first dose. But after that second dose, particularly if you're younger, some people do have side effects. And those side effects can put them in bed for a day, sometimes a day and a half. But they're just side effects, and they're a sign that their body is reading that instruction sheet and they're having a very good response, which means they're making lots of antibodies. So what I tell everyone is that if you get those side effects, pat yourself on the back. That means your body's doing exactly what your body is supposed to be doing, and don't worry about it. Take some Tylenol or take some ibuprofen and you'll feel better tomorrow. The reason that younger people are getting these side effects more than older people is that as we age, our immune systems just don't have such a big response. And so we're seeing that our older folks are having, for the most part, almost no response at all after the first or second dose. It's more people, and we know this from the healthcare workers that have been vaccinated, that are in their 20s, 30s, maybe a few 40-year-olds that are having this much more robust response that kind of puts them in bed for a day. But again, no one's getting COVID. It's been extremely safe. There's been a few allergic reactions, very rare, and that happens right away. So that's why we watch you for 15 minutes before you can leave. And I just have to say one more quick thing because I know we're getting short on time. Remember that the coronavirus is killing people. Here in Montgomery County, we've now lost over 1,200 people in the last year since March 7th, since we got our first cases. So that's a guarantee that if you get the coronavirus, a percentage of our friends and family are going to die from the coronavirus. So far, there has been no one that has died from one of these vaccines. And all 3 vaccines have been 100% effective at preventing hospitalization and death. So that's what you have to weigh. Something's going to 100% prevent your death, or something that absolutely you can die from. So I would just urge everyone to really think that through and hopefully agree to be vaccinated.
We have 1 minute. I love that explanation. Others are commenting on it too, that the instructions are being inserted into us to produce those antibodies. I love that because I think that's something tangible people can understand. So I appreciate that. Now, just very quickly, we got a bunch of questions. I'm going to shoot them off rapid fire, and then we'll close up. About the categories and adding into as far as pre-existing conditions, maybe the senator can speak to quickly. Will that be changed? I know one question we got a lot was about asthma. Will that be added into the categories?
There's no current plan to change categories based on medical condition.
Great. Okay. Next question we got. This would go to Commissioner Arkush. When will the mobile units be beginning? I guess that depends on the vaccines we get, but
Well,
yeah.
we're starting this week at some of
great.
the elderly housing that I talked about. We're doing 2 units this week. We're going to see how it goes. We're going to learn from that. We're going to improve our process. And then hopefully next week we'll do maybe 3, do it for 3 days. But to say this again, it's all about how much vaccine we get. We have the ability to deliver. We could be delivering thousands more doses a day. We just don't have enough vaccine yet. So we have to just beg for your patience.
Okay.
We know this is so frustrating.
Going toward one more, people are asking any idea if you did get the vaccine, let's preface that, if we did get more, would we be doing drive-through vaccination areas?
Yeah, we might. I mean, we're going back and forth on that because a lot of people don't have cars. And so we have so far set up in places with public transportation, and then so people can drive or take public transportation and then walk in. It's always concerning if we require a car. So I don't have a good answer for that yet. We can do massive vaccines and have people walk in and do it safely. So that's probably where we'll end up. But we could end up doing some cars too.
Yeah. Well,
Should say
this has all been. Oh, go ahead, Senator.
The state is considering some max vaccination sites around the Commonwealth, and Montgomery County could be a location for one of the state mass vaccination sites.
Well, that is a good way to end. I know we're 2 minutes over time. I cannot thank you enough for what you continue to do, what you have done. And all this information is so key. Again, to those who are listening, thank you, or viewing. We will share this video out. We will follow up with the information for all of you. I know some of you are watching. I know you're commenting. Thank you. Thank you to Beth Duffy. Thank you to Commissioner Arkush, Senator Haywood. We're really indebted to you. Particularly, I know I live in Montgomery County. I think Commissioner Arkush, you've done an excellent job. I think we were the first county really to have a shutdown. So I think thank you. Thank you to you. And so I also want to say to those who are listening or participating, we will share that very key information for all of you. And to be positive, who knew a year later we would have all these people being vaccinated? That's what we need to focus on. I just want to make another plug. We are in another election season. You see how important elections are. You can register right now. The primary comes up May 18th. You can go to votespa.com. Make sure you're registered, check your registration. Whether you want to sign up for vote by mail or go in person, that's great. Please continue to wear a mask, social distance, and respect yourself and others, and stay healthy. As our outgoing Dr. Levine said, stay safe, stay calm. So I think we all need to do that. So thank you again to everybody. Thank you to Linda. Thank you to Michael, who's been behind the scenes doing all of the tech work here. And I'm very grateful to all of you. So have a good night.
And our panel, before we go, I just want to say this. Please, 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 I'm inviting you back in the next couple of weeks, maybe not 2, maybe 3, that we could get some updates on what's going on. I appreciate everything that you have done and the time you've taken with us. And most importantly, I think we had up to 74 people that came on, that they can spread the word. So I'm hoping that we'll do better next time. But thank you, thank you, thank you, everyone. Be safe and God bless.
Thank you. Good night.
Thank you.
Bye-bye.
Thank you so much.